Good afternoon, good morning, everybody, for our next installment of our virtual internship webinar series. My name is Danny Rubin. I'm the founder of our company, Rubin, and we are based in Virginia Beach, Virginia, and we provide online curriculum, online resources for business communication skills. For the instructors who may be new to us today, show of hands, do your students ever send you emails that look like text messages? You ever get those? See some hands going up. So one of the skills that we address is effective writing for professional situations. Also speaking on the phone, speaking in Zooms, real life, best practice for business communication. And to help us do that, we bring in professionals from different occupations to underscore why these skills are so important in any job, even in the world of dentistry, where we're joined today by our special guest, Dr. Daniel Vacendak. Spoiler alert, he's my dentist. And so I thought who better to help us understand this world than Dr. Vacendak, who's just been great to get to know over the last several years. His practice is based in Chesapeake in the southeastern corner of Virginia. And we will hear from him and his bio and get into what he does every day in just a few minutes. Again, if you just joined us, please introduce yourself in the chat with your school or your program, your city. Just tell us where you are. We'd like to see that in the chat. And we have Ms. Kelly Greer here providing sign language for those who need it as well. So the first thing we're going to do is I'm going to share my screen and offer some resources and give you some look ahead to our next webinars. Okay, so let me just do a quick screen share, keep my chat open. Welcome from Christiansburg and Hokie Country, Southwest Virginia. Thank you for being here. Tell City, Indiana. Thank you. So for the teachers who don't have this yet, we love to give out free resources that help students with their communication skills. And we have 5 exercises to help boost morale. Boosting morale we've gone through COVID for 2 years and we're heading in the home stretch of this school year. So here's some exercises to give everybody a boost. Learning to uncover your why or your true purpose. Learning how to start conversations with mentors. Sharing stories of your work ethic for cover letters, a technique for dynamic public speaking, and a way to promote yourself in social media with what we call a hashtag, personal hashtag. So these are all free and we'd love for you to have them. We also get, and I'll explain how in just a second, we also give out every time an online presentation checklist, which is a one sheet of some best practices for how to present, give speeches, group projects through virtual environments. So if you're new to our Rubin community, you don't have these resources yet, and you're an educator, all you have to do, as we always do, please go to the chat, type the word interested and your email address. Interested and your email address. And again, this is for the instructors, especially if you haven't been to our sessions before. And we would love to give you these resources to take back to the classroom. And what we'd like to do for those who are new to us is to schedule a brief conversation on the phone tomorrow, 5 minutes, so you can have these resources and we can explain how to implement them into the classroom and how to share them throughout your building. Okay, because we love to give these out and not let the conversation fizzle out today. We wanted to start here and go into the classroom. So please request it if you don't have it, and we will be in touch shortly with an invite on your calendar, which you can adjust with us so we can chat tomorrow and pass it along. So continue to do that if you'd like. I want to mention our next session, which will be Tuesday, March 8th, the world of the service industry. We have a great guest. She has a great story. She started at a hotel front desk. 3 years later, she managed the hotel. So we want to teach students that you can come in at any level, restaurant, hotel, retail, and if you work hard enough, you can rise the ranks, sometimes very quickly. So that'll be a great conversation about a pathway through the service industry, even where you live, okay? If you would like the lessons that I just mentioned, please send an email. If you're watching on a recording, sometimes people do, please send us an email to this email address in red with the subject line below. We'll get it to you. And finally, everyone here live with us We're going to send you a certificate tomorrow as proof that you were here, that you can put up in the classroom, put in a portfolio, a printed certificate, that the teachers, you'll have a box here, the teachers can write the student's name one at a time in here so that students have it as their own unique copy. So all of that tomorrow. And so with that, I'm going to hop out and welcome in our special guest, Dr. Daniel Vacendak. Thank you for your patience. And thank you for being here and in the middle of your busy Wednesday, running a dental practice and seeing patients. So let's start by telling all of us your background and your journey to the seat where you sit today, and then we'll get into more of the work that you do.
Sure. Thank you for inviting me, Danny. It's a pleasure to be on here with you and all the students. My name is Daniel Vacendak. I'm a general dentist that practices in Chesapeake, Virginia. I started this practice with my mother, who's also a general dentist. And she actually went to dental school when I was a child. So I actually got to see her go through school as well, before I became interested in the field and started myself. I went to undergrad at Wake Forest University, where I studied biology and chemistry primarily. I also had an interest in Russian, although my vocabulary has declined significantly since then. Anyway, I went on to the Virginia Commonwealth University School of Dentistry, where I graduated with my doctorate in dental surgery in 2011. And I've been here pretty much ever since.
That's right, because I was one of your first patients.
That's right.
For those I mentioned before, so he is my dentist. And I always love to interview people who I know and people who I respect in different fields. And so you started right when I moved back to where I live, and we were one of your first patients in the door.
That's right.
And we've sort of grown up in the business with you, which has been nice. Every 6 months, we sort of check in on life. Now, one thing that I always, those of you who have been here before, raise your hand if you've been to one of our webinars before. Let's see a show of hands. Who's been here before? Okay. What do we always do with our guests? When we start talking to them and we start discussing their career, what's that R word that we always do? We always show we do what before. And by the way, we have Miles Garrett saying, "Go Deacons."
Thank you.
Go Demon, Wake Forest Demon Deacons. I caught that. What do we do when we meet somebody? Kayvon, correct. We do our research. Excellent. So what I did, I'll share my screen one more time, is I went to the Vacendak Dentistry website and I was poking around about services and bio. Here's Dr. Daniel's mom, whom he works alongside. And I was looking at your bio. Now, it doesn't take long to find someone's bio. It's sitting right there. And there's a lot of value in looking through it. Now, I have a couple of questions for you that caught my eye reading your bio. One says you have a specific interest in community service, which we'll talk about, in this dento-alveolar. Did I pronounce that right? Dento-alveolar surgery. Now, what is that?
That's, I guess, fancy lingo for oral surgery, extraction of teeth and managing the bone. The alveolus is the bone that supports the teeth. So that would really be like tooth and bone surgery. Okay, thank you. So this is the kind of thing that I wanted to ask him because it shows that I went through his bio. I was trying to learn about his background before we had this conversation. Now, let me ask you, Dr. Daniel, because you hire people. You run a practice, which we'll talk about. You hire people. People sit down in front of you for interviews. What does it mean when someone comes in the first time and they know a little about the practice and a little about you? What does it say about that person? It shows me that they're interested in employment or whatever their purpose is in coming in that day. It's very helpful. That's right. It also helps the conversation be more productive. It makes it more productive and makes you more likely to want to spend time with them because you feel like they really do genuinely want to work with you. And you're not just another interview for them. And it also said community service. And that made me think, because I have some background in a past life. I did public relations for the Virginia Dental Association. And I know one of their big programs is something called Mission of Mercy, which are these huge day-long or weekend-long dental clinics in like convention centers or fairgrounds. What goes on at Mission of Mercy? Who are dentists like you treating? And are you getting paid for something like this? That would be an all-volunteer clinic. And typically it's run in partnership with the Virginia Dental Association in this area. We would go to areas that maybe lack access to dental care, and usually they also provide vision care and screening for like hypertension or diabetes. And we would provide dental treatment for people that might not have access to dental treatment for whatever reason. And I mean, at some of these clinics, people will stand in line for days
Yes.
to get treatment. It's pretty wild, very humbling experience to take part in that.
Absolutely. So not only you work as a dentist, you go into your office, you see patients, but there's opportunity to give back in the community, probably in any community around the country. I have to think these types of programs go on. There's a chance to give back in a meaningful way through your craft, through
Definitely.
your expertise. And I think that's important as students know. Now, as we get into our conversation, what I'd encourage the students and teachers to do, please go to the Q&A area now along the bottom row of Zoom. Click on Q&A, and I want you to start putting your questions. When you write your question, please include your name and your school so we can give you proper credit. Don't put the questions in the chat because the chat moves and we can lose it. Put it in the Q&A, and we will be pulling questions from there as we go along. So I'll start looking for your questions as I see them. Right now, let's go back to sort of a day in the life. Take us through, you're in the middle of your work day, you took time out, which we're grateful for. Tell us what today looks like. You came in the door, what did you do first?
Okay, well, we actually had a team meeting to start the day. We have one every single month.
Okay.
We bring everybody together and we discuss issues around the practice that need to be solved, or talk about things that are going well. But it's a chance for everyone to get together without the clinic being run, where we have a chance to talk to each other and connect. After that, let's see, I extracted a tooth on a 10-year-old. He was a wonderful patient, did really well. I made a crown for somebody this morning, diagnosed a number of issues. I did some direct restorations fillings. In my field, our primary concern is the study, diagnosis, and treatment of pathologies of the oral cavity. But we also have to remember that oral cavity is attached to a person. So you need to be able to talk to people effectively and manage their anxiety, communicate what's being done so they understand. Consent's a very large portion of what we do. That was my morning.
Sounds like a whole day, like a whole week. And it's only 12:43 Eastern time. So what I'm hearing you say is that technically you need to know how to be a good dentist, how to extract and crowns and everything, but you also have to have great interpersonal skills, which I think you do. I've sat in your chair. I think knowing how to talk to people and make them feel assured that whatever's about to happen, that you have their best interest, you're going to keep them safe. So it requires working with sort of both sides of your brain all day. Are you sort of going back and forth between like the people person and the dentist? Do you feel that way?
For sure. Well, there's no getting around it. And oftentimes you're really having to talk through what you're doing as you're doing it, as a way of managing anxiety for people. But yeah, that mouth is attached to a person that you're treating, and they have to participate in the treatment. They have to hold their mouths open. They have to stay still. I mean, it does require a great deal of communication to provide treatment effectively. I mean, the technical skills are a must, but you also have to have those communication skills.
Very important for the
and
students
also to have them buy into the value of the treatment that they're receiving, because you can explain all day the things that are going on in their mouth that need to be addressed, but if they don't understand that because you're not communicating it effectively enough, then they're never going to pursue treatment for their necessities.
That's good. Now, I know it's been great to see. I've watched your practice grow over the last several years. How many employees do you have today?
Ooh, I believe we have, 4 in the pack, 4, 8. So probably about 12.
12 people.
Yeah.
And I mean, that's a real robust team now. There's just a lot of activity going on all day. What has it been like for you and your mother to sort of manage that? Because you're wearing that hat too, of like managing a business while you're treating patients. How do you juggle that? And we'll get to some of your questions shortly. Go ahead.
the business side of things is totally separate from the clinical side of things, but it's essential because you can't really provide effective clinical care without having a well-run business. And that's something that you, as a dentist, unless you've owned a practice before, you're almost learning as you're doing it. I mean, we have a consultant firm that's been helping us the last couple of years in developing systems and managing things, which I really wanted to touch on something as well. You had mentioned the topics that people can access before we started this discussion.
Yeah.
In your share. And a lot of those topics are things that you have to manage on a business level too. It's the same, what is your purpose? What drives you?
Oh, yeah.
That type of research. I mean, it's not just useful to you as a student. It'll be useful throughout your life to know those the answer to those questions. But basically, managing the business aspect involves a great deal of communication and careful thinking about how you want your business to run, because you can't really provide effective clinical care if the business isn't running. I mean, the doors have to stay open, and people need to be paid, and
That's right.
people need to know when they're supposed to come in and what they're supposed to be doing, every minute of the day.
That's right. That's great. I want the students to hear that many dentists do run their own practice, and so it requires another layer of skill that you may not even think about when you're in dental school. Maybe they help.
I never go over that in dental school.
Which is kind of wild to me, because many dentists do have their own practices, but to not even sort of throw you out on your own,
Sure.
it's kind of interesting to me, because I think that's just as big a part as the actual dentistry. We have some excellent questions. Let me start pulling them out of our Q&A. Thank you, everybody, for your questions. We have Ankita Kashyap from Tell City High School. What's your favorite part about being a dentist?
Well, it has to be that amalgamation of art and science that I get to apply to help people with their problems. I've always had an aptitude for art, and I always enjoyed studying the sciences, and I really enjoy helping people with the issues that bring them to my office. So that smile that I get when I've fixed something for somebody is priceless.
Love that. Love that. Question from Lisa Hartso and her students, perhaps in New Jersey. What is the hardest dental procedure to do?
Ooh, well, I guess that would depend on, your aptitudes and what you like doing.
What's the hardest one for you? The most challenging one that you come across?
Let's see. Probably for me, a complicated root canal would be pretty tough. Sometimes surgical extractions can get complicated. But yeah, probably something along those lines. But sometimes managing complex restorative cases can be difficult as well. But it depends on the patient.
Okay. By the way, for those who are putting your questions in the chat, please put them over in the Q&A. Like I said, that it's hard to keep track over there, so please put them in the Q&A. Question from Braden. What does it mean to crown a tooth?
Okay, so that's when you take a tooth that is structurally compromised for some reason. Maybe it was a back tooth that got a root canal, or maybe it's a tooth that broke in half, but there's still enough to save. We take that tooth and we make it like skinnier and shorter, and then we replace all that missing tooth structure with like a cap, and it fits over the top. It's almost like you're resurfacing the tooth. And that's done to basically restore a tooth that couldn't be otherwise restored. Maybe it's vulnerable to fracture if we were to try to put a large filling on it, or like I said, maybe it's structurally compromised from something like a root canal or an injury. But yeah, that's about what a crown is.
Okay, thank you for that. A question that I haven't seen it in the Q&A, but it often comes up, so I'll ask it, is what if students who are in high school, for example, what types of classes would you recommend that they take to sort of build a foundation for the skills they'll need in dentistry?
Great. A strong background in the sciences is essential. Really all the pre-dental courses that you're going to be taking in college are going to be based in biology and chemistry. There's going to be some other requirements as well, but basically, a knowledge or a strong background in the sciences. An interest in art is helpful too, because you work with your hands a lot. And, I found that in dental school, that was really the first time a lot of us had been asked to really make anything with our hands. And if you hadn't done anything like that before, that there was kind of a steep learning curve there. So yeah, an interest in sculpture or, sketching or painting, that can be very helpful too. But a strong background in the sciences is essential. That'd be the most important one.
I like that answer though. Some other, sculpture or painting, like things you may not think about directly, but that's, you're, like you said, you're sculpting teeth, or you're making it, you take some piece out, it's got to look, when you replace it with something else, it's got to look like it did. So that's an element I didn't
or
even,
better. And
or
really,
better.
and studying, color is very important too. I've actually gotten more into that in the last few years in my clinical practice, is understanding, opalescence and color and tooth structure, because I have a CEREC machine in my office, which enables me to make crowns and things like that here in the office. And building that color in a three-dimensional way into the tooth using ceramic, you really need to understand how the different shades interact to mimic natural tooth structure.
Wow. Wow. And what was the name of that machine or system? Is it
CEREC, it's spelled CEREC. It's an acronym that stands for like chairside restorations. I forget the what every letter acronym stands for.
This is good.
Chairside restorations.
We like sharing specific words and terminology from the industry. Here's one, and I'm going to say some lingo that maybe you'll understand. Question from Virginia Medlin. If you were to hire a new dental assistant, do you look for DANB exams, BLS, or are there other certifications? And do you prefer years of dental experience first? What do people need to have in their resume to become a dental assistant for you?
Interpersonal skills, and you would assess that during the interview and maybe a working interview as well. Radiographic certifications are essential so that you can, take radiographs in the office. A training program can be very helpful as far as knowing what the instruments are, but every process in every office is going to be a little different. So there's always going to be a learning curve to working with a specific provider. Because like I said, everybody does things a little differently. There's so many different materials and methods.
Okay.
But yeah, basically what we're looking for is a good attitude, being willing to, learn the new processes that you come to the office with, and excellent interpersonal skills. And like I said, that radiograph certification is very important.
Okay, that's a great answer.
And obviously, a professional demeanor can be very helpful as well.
Well, yes, as we've said, I mean, the interpersonal side is just as important as the science and the medicine. Stacy Griffey from she has dental career students at Buchanan County Career Center. How many patients do you treat in a typical day?
Oh, that's a good question. So on my personal column, I probably treat between 12 and 16 patients a day, but then there's also the hygiene department that's running, and let's say the 4 hygienists running are typically seeing maybe 8 to 10 patients each a day. So, there's 4 hygienists running, so that could be 32 to 40 patients on that side that we have to provide evaluations for throughout the day.
Wow.
As they're receiving, periodontal treatment, in which case sometimes they don't need an evaluation for that particular treatment. But yeah, so it's something along those lines.
Wow, it's a lot of people in one business day.
But although some of those, that number might shrink if I'm doing a complex procedure. I might reserve more time for a single person. Like if I'm doing multiple crowns in one visit, that might be a 3 or 4 hour appointment, and I might only see 3 or 4 people that day. It just kind of depends on what is scheduled for that day.
Sure. Interesting question here from Pamela Smith. Thank you, Pamela, and cool you're attached to. Where do you see the future of small independent dental practices in the face of larger dental corporations who seem to be more prevalent? These big box stores essentially pushing out small mom and pops.
Sure.
What is your opinion on that, and how do you see that affecting the future of the profession?
Well, they've obviously become a larger presence in our profession over time. But when I look at a large group practice like that, a corporate office, they're really providing a different product than small group practices are. There's a different level of treatment that you're getting from there as opposed to here. There's a lot of personal connection with somebody that owns the place and is going to be there for years and years and years. And when you look at the way businesses are managed from a corporate side, I mean, they have shareholders and large corporate structures that need to be supported. So they're not always. It's difficult to run many offices. So they may or may not be around forever or as much of a presence, and that pendulum is always going to swing back and forth as well. But I think the small practitioner, the solo practitioner, or more likely small group practices is going to be around for pretty much forever.
Okay. At least yours, right? I mean,
Yeah,
that's
for sure.
you can't speak for all the others, but you intend to be around
Yeah, it's
for a while.
that's never been a problem for us, or really any, that's not something that we have any anxiety about or any
Okay.
issues.
Okay. A question I think is coming from these dental students down here in Norfolk. They said, do you recommend a business minor or some other degree that's not science to get a background in something else? Or do you really need to come out of undergraduate or a bachelor's with a degree in some science related field? Or can you transition to a dentistry by doing something more like liberal arts?
You can have a degree in anything. I mean, I had classmates that had degrees in music. I mean, you can have a degree in whatever you would like, but there are prerequisite courses that you need to take to get into dental school. So you don't necessarily need to major in biology or science to get into dental school. But a lot of the classes you're going to be taking to get to dental school are going to constitute a large portion of that major already. So it kind of makes sense to finish that out. Like I said, I studied Russian in college as like a secondary track. And I mean, I did that because I enjoyed it. But you can study whatever you like, as long as you also have those prerequisite courses.
Yeah.
And and even studying science in dental school is going to be different than it is in undergrad. When you get to dental school, the science you learn is going to be a lot of memorization. It's not so many like essay based tests and that sort of thing. They're going to extend your big stack of data to memorize, and you're going to have to pack that in your mind over time.
Yes, that's right. It's not essays at a certain point. We have a question here from, hope I pronounce the student's name right. Warud El Farmawi. What is your business strategy to keep customers loyal? How do you, since you often see people maybe twice a year as you're instructed to do, how do you maintain a connection to your customers, to your patients?
Oh, sure. That's an excellent question. That's a vital problem to solve. But I mean, really, it's providing excellent care and treating people like the individuals that they are. I mean, you don't really want to push people in and out, even if you are very busy. You want to make sure that people feel cared for, and that their treatment is organized, and that they have an appointment scheduled when they leave. That helps a lot, because if somebody leaves without an appointment, there's a good chance that they may not schedule again, or they might forget and then might not be back for a few years until they have another problem. So maintaining constant connection with your patients is essential.
Very nice. We have a great question here from Sarah Jenkins and her students, her dental science students at Lafayette High School. Thank you. 21 students here watching through their classroom. What is one piece of advice you'd give to students who are trying to make the career choice between dentistry and some other healthcare field? If they're looking at, I could do all kinds of things in the world of healthcare, science, medicine, make your pitch why dentistry is the path to choose.
Sure. I'd say one thing to help you make that decision would be to spend time in the different fields that you're interested in serving in. I mean, I followed my mom around a lot in the clinic, and some of our, now my colleagues, but, people that were practicing at the time. And that's actually a big part of getting into dental school too, is having, hours spent in the clinic, so that you can say definitively, I know this field and I'm interested. I like the work that's being done that I've seen, and I would like to be a dentist myself. So spend some time in the offices with dentists, or if you're interested in medical school, with medical doctors in the specific field you're interested in. And that'll help make up your mind a little bit as well. Because I mean, if you spend some time in there, like, man, this isn't for me, you'll know that pretty quick.
That's right. That actually, I want to ask you a follow-up about that, about how students can get involved even in high school. And this is something we talk about a lot in our webinars, is the value of follow-up question. So he sort of cracked the door that says, while you're young, while you're in school, shadow, look around, experience what it is to be in the environment to see if you like it. So I'm going to ask him a follow-up question that says, if you're in school, like let's say someone's in high school where you are, what could they stop by? Could they observe? Like, what's possible as a student to see if dentistry is right for them? What would you say?
I would say that we do that all the time, and it's usually students that seem to have focus and drive. Well, usually they're patients here, and they'll say, I'm really interested in going to dental school. Do you mind if I come by at least once or a few times and see what it's like? That happens all the time, or college students often ask that question as well, because especially for the college students preparing for dental school admission, they need those shadowing hours anyway. But yeah, just ask your dental provider is a good one, or if there's a specific specialty that you think might be for you, like orthodontics, oral surgery or something, you can just call an office and talk to the office manager and ask if they're willing to have students come visit. Yeah, that's always something that we're interested in doing. I'm not sure I know any colleagues that would turn away a student that was interested in doing dentistry.
That's a very powerful answer. So what you're saying is, if you ask, more likely than not, they're going to say, sure, come on by.
I mean,
how many students,
yeah.
how many, raise your hand, how many students who are interested in this field, or really any field, would feel like they have the confidence to say, can I come back by and shadow? Let's see some hands up if you're willing to do that, right? I would see a lot of hands. I think that's very important, that you know that you don't have to feel like you're not allowed to ask for something like that. And the worst they could say is no, but like he's saying, the odds of them saying no are pretty slim. They're going to say yes.
Mm-hmm.
And he said it was flattering. They want to like watch him work, and that means a lot. Like they really respect the work he does and they want to observe it. And raise your hand before we get off the topic. Who understood what I just did there with a follow-up question? Did everybody see what I did? Where I listened for something I want to learn more about. So I asked a follow-up question. I'm not just going down a list of questions and checking them off. I'm having a conversation. And if it's something I want to learn more about, I'm going to ask about it. And I'm just going to go down that road. I'm going to get off the main road and go down the side road, because that's a good way to hold a conversation with somebody. So we're trying to teach these interpersonal skills alongside, today, dentistry. I have a great question here. Kayvon Roberts, you're one of my favorites because he's always here. This is a great question from Arabia Mountain High School. Since you're a dentist, who looks at your teeth?
My mom is my dentist, and she's been my dentist.
I figured, but I wanted to ask you.
She placed the sealants that are still in my mouth.
Hey, there she is, Dr. Sheila. Hello.
And I'm her dentist, so yeah, that's how
a family affair.
Yeah,
I love that question. Miles Garrett asks, how many years I think he's your demon deacon buddy. So how many years of school does it take to be a general dentist? How long do you have to be in school?
Generally 4 years of undergrad. It used to be you could finish or you could apply to dental school without a degree. Usually now, they want an undergraduate degree of some kind. So usually about 4 years of undergrad and then 4 years of dental school typically. Although I think maybe the dental school, the Pacific, maybe is only 3 years long. I don't know that for a fact, but most schools are about 4 years long.
So it's about 8 years of school, all told, 8 years till you're out there.
And then if you do a residency, that might be a year or 2 or 4, depending on, if you're doing a specialty, like the oral surgeons, that's another 4 or 6 year residency tagged on after dental school is over. So, but you really never stop learning and, growing. I mean, you're always, if you're interested in the field, you're going to be providing services and you're going to go, I really like this a lot. I'd like to do more of this, or, this is an interesting problem that, we face in the clinic. I'd like to have better solutions. So you're constantly learning and training and growing. That the studying never really stops. And that's, I think, why they prioritize people that have done well in academics for spots in the dental school class, because you really have to be interested in studying for the rest of your life, because this is a craft that you never stop learning and growing in.
Wow, that's an important piece of advice for students who are thinking about the field. You have to be committed to learning forever, and that probably goes for most jobs. There's always something more to learn, or to, a new tool, a new technique, working on your skills. It's sort of a lifelong pursuit. There's a question here from an anonymous person. And if it was your question, please tell us in the chat, because I think it's an important question to get sort of hammered out. What is the difference between a dental hygienist and a dental assistant?
Sure. And that's an excellent question. A dental hygienist usually has a certification of some kind, either a certificate or sometimes a bachelor's degree. I actually teach at the hygiene school here in Norfolk, and they graduate with a Bachelor of Science in dental hygiene. But the difference between the two is that the hygienist is going to be providing hygiene services for the patient, including scaling and root planing, diagnosing and taking radiographs and that sort of thing, and assisting for treatment planning as well for the doctor. Whereas a dental assistant is going to be assisting the dentist directly, chairside during our procedures, handing us instruments, getting materials ready to apply, taking impressions. But the big difference between the two is going to be actually providing like hygiene services for the patient. I mean, a dental assistant can use like a rubber cup to polish teeth or whatever. I don't think you're going to find many practices where the dental assistant's doing all of that. And mostly it's the hygienists can be doing that for their own patients. But yeah, scaling is going to be a big differentiator between the two.
Okay. Okay. Thank you for that. Couple interesting questions here. Then we're going to do a quick little writing exercise together. Question from Medina Shamansarova at Pinnacle Academy. Will a person who has studied and worked in a different country have to restudy in order to be a dentist in the United States? Do you know how that works? If you already had skills somewhere else?
Okay, so you mean somebody that was a dentist, maybe in
perhaps, or maybe they had some degree of schooling. Do you know how that works?
So if you were a dentist in another country, there are programs to assimilate dentists that were trained in another country here. Actually, we had 4 students in my class that were, one was a dentist in Iraq, one was a dentist in Korea, and I forget where the other ones had practiced. But you know, that's a nice way to get licensed and here in the States. But if you've done higher education, maybe in another country, and you're coming over here, it's certainly not essential to repeat that. Although you'll have to talk to the dean of admissions of the individual dental schools and find out, what schooling they're going to credit for, or what they want to see for admissions into dental school here. I would say that learning science in another language is tough because of the vocabulary. It's like almost like a different language in and of itself.
Yeah.
Anyway,
sure.
So being familiar with science in the English language is going to be very helpful for being in dental school in the United States. But yeah, you'd have to talk to the dean of admissions and see what certifications and degree programs you've been in other countries, and see if that applies here, if they want to see additional courses or what have you. And that's really true of all students. If you're interested in dental school, I would encourage you to contact the dental school that you'd like to go to as early as possible, and have them build you a roadmap to getting in. Because that's another thing we had talked about, calling a dentist and asking for internship opportunities. If you contact a dental school admissions program, they will be happy to meet with you and discuss your transcript and the things you need to do to get into dental school. I did that as a college student myself, and that was very helpful. They can tell you what classes you need to be taking. If your transcript isn't strong in one area, you need to work on this area, or what have you. But the dean of admissions is very accessible generally at the dental schools in this country for helping you apply and have
That's
success.
Great. That's great advice. I mean, we really appreciate advice like that. But this is why our company, what we do. Okay, the next point is like, well, then how do I call them? How do I write them? What do I say? So like saying all the right things. This is where the rubber meets the road. So we get into these conversations because your advice is great. And students should have the confidence to reach out to a dean of admissions and ask these questions. But how we construct that message is a huge part of the equation.
Very important. And all the writing skills that you had mentioned are essential for admissions and throughout life. I mean, that effective communication is the half of my profession that I didn't learn in dental school.
That's right. Everything they didn't teach me in school, right? As they say. Well, on that note, we're going to do something very quickly. When you talk about writing skills for life, there's no more important writing skill for life than to sign your own name. And we know that, raise your hand if in your school cursive writing has sort of gone, as they say, the way of the dodo. Any hands up? Is cursive writing sort of a thing of the past? But we don't often write in cursive. We're not writing letters to each other. But there is one time where we have to use cursive all the time, and that is what? To sign our name. So what I want to have everybody do, we've never tried this in our webinar before, but we're going to break some ground. I want you, if you're a student, you're in the classroom, you're at home, wherever you are, I want you to find some paper and a pen or pencil. I'm going to give you 20 seconds to do that. I want you to find something to write on, or if you have a tablet, you can use your finger or a pen or one of those digital pens. But I want you to find something to write with. Okay? And Lisa says my students are not taught this in elementary school. It is not taught anymore, but we have to sign our name. Where do we sign our name? On transcripts and applications for college, for job applications, tax purposes, dental, release forms. Like, we sign our name all the time, right? It's just an everyday part of life. And to not know how, and having to sort of fake it the rest of your life. We want to make sure students know how to sign their name. So what I want you to do, hopefully you've had enough time to grab something to write with in our digital age. I want you to write out first, just take the first letter of your first name and last name, maybe on 2 different lines, or, space it out, and write out in cursive your initials as you would prepare to write your full name. Okay, take a second and do that. I wish I could have you share it with us in the chat, but it's not going to really work, but I'll hope that it's going on. And if there's any teachers who are watching the students do that right now, please tell me in the chat, because I'd love to know if this is actually worthwhile, but I wanted to give it a shot. We do lots of writing in this webinar. We want to always teach writing. So hopefully you've written your initials to your first and last name. Now I want you to fill in your name. Take your time. If you haven't done this ever or once or twice, this is not graded, at least not by us. Maybe your teacher wants to use it as some sort of completion, but take your time and write out the rest of your name. I'll give you a few seconds to do that. And, going back to our guest, these are the things they say they don't teach you in school. We don't think about until you're out there and you're like, oh, well, how do I do that? And certainly we can Google it, we can go find it out, but wouldn't it be nice if we said, I learned such and such in that class, like they would have taught you at Medical College of Virginia, at MCV, like 101 on running a practice. And then you're like, you learn on the job, but you had at least a foundation. Would you have preferred one elective to be on like best practice for, practice management?
Definitely. Or specifically team management. I mean, that's something that is that you do every day, all day long. You gotta, as you're taking care of the patients, you have to take care of each other, and you don't want people to get burned out, and you want people to have high energy throughout the day. And the way that you do that is by making sure that you're filling their bucket and, making them get through the day in a way that's not as stressful as it could be. Right.
That's right.
Making sure they feel valued. It's essential to keeping a team together, because training new team members all the time can be time consuming and self-defeating. So you really want to have those skills so you can maintain your team.
That's right. You're thinking about the patients and also thinking about your people too. I mean, you're wearing so many hats when you're running a practice where people are running this way and that, and you have to always be just mindful of everybody's whereabouts, like you said. Just a quick in the chat before we finish out with these slides I mentioned. Raise your hand or tell us in the chat if you just signed your name in cursive. Can someone show a hand up or tell us in the chat if you just signed your name? And were you familiar with doing that? Was it kind of weird to do it? You want to practice it a few more times? Tell me in the chat. I'd love to know your feedback, teachers too, if you thought that was worthwhile, because we want to push into areas where we think there's a need and it's not always focused on. So thank you. Thank you, Braden. I'm glad that you were able to sign your name. So for the instructors who may have come in just a few minutes after we started, I want to reiterate the free resources we'd love to give you. If you haven't requested it yet, we have exercises to boost morale. And even Dr. Daniel said these are some of the lessons that he would even reference as a working professional. They're not just done for the classroom, but we start in the classroom, learning your true purpose. Why do you do what you do? Why do you get excited to do what you do? Mentorship outreach, telling your story of success in cover letters, public speaking, promoting yourself professionally on social media. We'd love to give new educators to the Rubin community. That is a Google Drive folder of free resources, along with an online presentation checklist for how to give great virtual presentations. If you would like these resources and don't have them yet, please go to the chat, type the word interested and your email address. As I said before, if you're new to our community, what we'd like to do is schedule 5 minutes on the phone tomorrow to say hello, learn about your class, and help you make sense of this content for not just your class, but for your school. These are skills that are really for everybody, and we want you to share them. So we'll send you an invitation for a call. If the time doesn't work, just reply back with a different time. It is no problem. Finally, we have our next session on the service industry, our next internship on March 8th. Love to have you there, learning about how to rise the ranks, in this case at a hotel. If you'd like our resources, our free resources through email, because you're watching on a recording, email us at this email in red with the subject line. We'll get it to you. And finally, everyone who's here with us right now will get a certificate that you were here. So look in your email on Thursday morning. Today's Wednesday, right? Thursday morning, and it'll come to you in your inbox. So keep an eye out for that. As we wrap up, it's just now 1:15 Eastern time. We always keep it to 45 minutes. Let's have Dr. Daniel, give us sort of your parting advice to students who are evaluating this career and they say, well, I like sciences, I could go a million directions, why dentistry and why does it get you out of bed every morning?
Well, when you meet people and they come to you in pain, or they're not able to eat properly, or they have an aesthetic concern that stops them from smiling every day. I mean, these are the things that get me out of bed in the morning, and that I enjoy most in my practice. So if you enjoy working with your hands, you enjoy making things, and you enjoy working with people, and you're interested in a health-related field, I would strongly urge you to take a look at dentistry. It's a very rewarding, personally, financially, spiritually. I mean, the types of connections that you form with people and you help them with a problem like that are immense. I mean, when people you're in their space and they're in your space, and you're working with them very close together, it doesn't get much more intimate than that. And helping them speak again or helping them eat again, it never gets old to hear somebody say that they've eaten steak for the first time again in years. I mean, that's
Wow.
or thank you. I haven't smiled like this in since I was a kid.
Wow.
I mean, that's pretty powerful stuff. So yeah,
that's wonderful. That's what makes it all worth it. So I think that's a great way to end it. Question about, we will put out a recording tomorrow morning as well. Those of you who you're here with us now, but if you want to watch it later, or a teacher wanted to grab this, we'll put it on YouTube. So keep an eye out for that. Thank you for everybody for being here. So how about some hands up real quick? Some Zoom hands up for Dr. Daniel Vacendak. What a terrific guest. Excellent advice. I want him to know that I'm continuing to brush and floss every day. So I hope I don't see you until my next scheduled cleaning. And so I'll let you get back to your busy day. Thank you so much. And I will see you soon, and we'll see you on our YouTube channel as a recording. So thanks so much, everybody. Have a great day.
You too.